Hey, hello and welcome everyone to Disorder Dialogue Series 2022. So, today in this episode of DD6, which I'm going to talk about learning disorder. So, before I shall really begin with this show, let me share a little bit of my introductory part. So, those who know me, that's fine. And to the people who are new to my platform, Good Mental Health, I would like to introduce myself that I'm the founder director of Good Mental Health, an RCI rehabilitation psychologist, a professional adoption counselor, also an international radio show host, a life coach, and a podcaster. So, this is a brief introduction about me. So, today, with this revolutionary journey of Disorder Dialogue Series 2022, I'm going to talk about the learning disorder. So, if any one of you know about this disorder, maybe a little bit about it, or there must be many people who must be unaware about what is a learning disorder, which is also nowadays called as learning disability. So, definitely in brief, I'll be talking about it, and I'm going to share all types of learning disabilities or disorder, you can say, and at the end, I'm going to share the intervention. So stay with me till the end of the show, and you're gonna gain a lot of information about learning disabilities. Yeah, and also those who are gonna miss this show right away, this show is gonna broadcast later up in all my social media platforms, which is going to be a great help to all of you, I believe. So, all right. So, starting with that, what is a learning disorder? Let's now begin with it. Okay. So, talking about what is a learning disability or disorder, I want to tell you that this is also called as learning disability, disorder, or learning difficulty, or learning inadequacy, right? So, it is a condition in which the brain causes a lot of differences, right? Due to which the person can get affected, and the way how one read, write, speak, or do math, or handle their similar tasks, right? So this is what happens, and these differences affect the person or the individual or the child. Basically, it is a childhood disorder, like mainly, right? And there are people who do get impacted in their adulthood as well, but there are certain reasons for that. So, all right, telling you that these differences affect the way the brain process the information. So individual find difficulty, in understanding a lot of things relating to reading, writing, speaking, do math calculations, or anything which is related to learning. So moving on to sharing the different types of learning disorders. So these many on the screen, these many other types of learning disorder. Without wasting much of the time, I would like you to stay with me. I'm going to start with the one which I have picked up, which is dyscalculia. So dyscalculia is a word that actually is very easily understood, that it is something to do with calculations, right? So when a child has difficulty with mathematics, right, wherein the child is, we won't say that, completely the person is, disabled, but inadequate in this certain particular skill. So maybe the mathematical skills are not too good enough in the child. So the child might find a lot of problems doing the math calculations, be it subtraction, addition, multiplication, or a lot of things, or even understanding the basic logical things that is being understood by anyone else. And now I'm going to tell you the symptoms, that how the parents can judge that the child is experiencing dyscalculia. So here are the symptoms of on the screen, which is problem understanding the basic arithmetic concepts, जैसे कि fractions, number lines या positive negative numbers बच्चे को अगर समझ नहीं आ रहे तो which is a symptom, या बच्चे को difficulty हो रही है math से related कोई भी कुछ भी वर्क करने में, कोई भी वर्ड्स हैं जो मैथ रिलेटेड है, सो दैट क्रिएट्स अ प्रॉब्लम इन द चाइल्ड इज अ रीजन. ट्रबल मेकिंग चेंज इन कैश ट्रांजेक्शन भी बच्चा इजीली हैंडल नहीं कर सकता है अगर मेसीनेस है उसको मैथ्स की प्रॉब्लम को पेपर पे लिखने के लिए. Also when the child has trouble with logical sequences, right? जो logical sequences are in the sense that ordering from 1 to 10, or it is just an example 1 to 10, but could be any number of sequences, right? So when the child is finding a lot of difficulty, जब बच्चे को sequencing ordering में difficulty लग रही है, which is also one of the thing, right, that needs to be understood, that is a symptom of, could be the symptom of dyscalculia. And when the child has difficulty understanding or describing the math process. So these are the symptoms of dyscalculia. Okay. Now we'll be talking about the next type of, the learning disorder, which is dysgraphia. So what is dysgraphia? Wherein the child has difficulty in writing. When you find your child is struggling, आपका बच्चा अगर struggle कर रहा है writing के task में, or it's getting really really difficult for you to handle this thing, and you don't know why the child is not writing or properly, or हेजिटेंट ऑफ राइटिंग, और बच्चे को आप लिखवाने की कोशिश कर रहे हो और उसका मतलब स्पेलिंग्स ठीक नहीं है, ऑर्गेनाइज नहीं कर पा रहा है बच्चा, राइट स्पेसिंग यूज नहीं कर रहा, और राइटिंग इज अ टफ एंड हार्ड जॉब फॉर योर चाइल्ड, देन इट इज something related to dysgraphia. So now individuals with dysgraphia, they find it difficult to even function, जैसे कि कुछ भी organize करना, planning करना becomes very difficult for them, because they find themselves inadequate in writing. So this is planning and organizing kind of things are way difficult for them, right? So let's know about the symptoms. Now how will we get to know that the child has dysgraphia? जब भी बच्चे में पुअर हैंड राइटिंग स्किल्स होंगे, पुअर होंगे हैंड राइटिंग स्किल्स, सो विच मीन्स दैट इज वन ऑफ द साइन. इनकरेक्ट और स्पेलिंग मिस्टेक्स बच्चा कर रहा है, ठीक है, और कैपिटलाइजेशन भी इनकरेक्ट है, और मिक्स ऑफ कर्सिव है अलोंग विद अनदर स्टाइल ऑफ राइटिंग को ऐड कर रहा है, मिक्सअप कर रहा है, जम्बल अप कर रहा है, दिस इज द साइन. एंड इनकरेक्ट वर्ड्स को लिख रहा है या बोल रहा है बच्चा. ऑल्सो कोई भी सेंटेंसेस को लर्न करना उसको डिफिकल्टी हो रही है, राइट, याद करने में, राइट, और स्लो राइटिंग स्पीड है, दैट इज ऑल्सो अ साइन. उसको बहुत जल्दी छोटे छोटे राइटअप्स में ही बहुत ज्यादा फिटीक फील होता है, दिस इज द साइन. इनअप्रोप्रिएट लेटर साइजिंग है, कुछ बड़े हैं लेटर्स, कुछ छोटे हैं, सो द चाइल्ड हैज नो अप्रोप्रिएट एक सेम टाइप ऑफ फॉर्मेशन में बच्चा नहीं लिख पा रहा है, इधर बहुत छोटा लिख रहा है, बहुत बड़ा लिख रहा है, सो स्पेसिंग भी उसकी ठीक नहीं है. From one word to another word, there isn't much spacing, और उसको spacing समझ नहीं आ रहा है, so which can be the sign of dysgraphia. So it is a writing disorder. Moving on to the next few more symptoms, which is difficulty with grammar. जब बच्चे को grammatically difficulty आ रही है, sentence structure में difficulty आ रही है, unusual उसका body का position हो रहा है, hand, especially when the child is trying to write down anything. So at that point of time also, you can understand there is something wrong going on with your child. And if it is sometimes happening, it's not a problem. But if it is a usual case of your child, that the child is really struggling with writing, then that is a serious affair. So moving on to the next symptom is saying words aloud. जब बच्चा लिखने की कोशिश कर रहा है, बहुत loudly बोल के उस word को लिख रहा है, because the child is struggling from writing, that is how उसको लाउडली बोलने की कोशिश करता है, सो दैट कि वो लिख पाए, अपना कॉन्सेंट्रेशन बढ़ा पाए. सो ये एक उसको डिफिकल्टी हो रही होती है, दैट इज हाउ द चाइल्ड डज लाइक दैट. और अपने हैंड्स को बार बार देखते रहना जिस टाइम पे वो लिखने की कोशिश कर रहा है, दिस इज ऑल्सो अ साइन. और बहुत ही अनयूजुअल ग्रिप होती है उनकी. यू कैन से दैट व्हेन द चाइल्ड ट्राइज टू होल्ड अप द पेन, it's not good, it could be something very differently, and which is not absolutely okay for you to look at, right? So वो और बच्चे ऐसे वाले अवॉइड करते हैं कि कुछ भी टास्क जिसमें लिखना पड़े उनको या ड्राइंग करना पड़े, because they are inadequate in writing. So that is how they want to just get rid of any writing stuff or work or any drawing thing wherein they have to hold the pen or pencil or anything, right? So they want to be just away from that. और उनको डिफिकल्टी होती है नोट्स बनाने में, स्कूल में, वर्क में. Why? Because in the school, when teacher is dictating anything, so children who have the problem in writing, of course they can't match up with the speed of the teacher. Why? Because unko already ek inadequacy hai in writing. So when the teacher is explaining anything, right, or making students to write down certain things, so it becomes very very difficult for the child to cope up with that situation. So these are the signs and symptoms of dysgraphia, which is a which is a writing disorder, as I mentioned. Moving on to the another type, which is dyslexia. Now I'll be talking about dyslexia, which is a reading defect, right? Reading inadequacy. The child find it very difficult to read anything. So in it, the child will be having problems with reading, with writing, with spelling, and speaking. So when a child, will be having inadequacy in reading, so definitely it's going to be very difficult for that child to be writing or spelling out something, or to be speaking out something. When he has a reading inadequacy, so all the other things are automatically going to be very difficult, can become difficult for the child, right? So that is what the parents, the educators have to understand about the child, right? And dyslexia is basically characterized by the deficit in the word recognition, decoding, also the spelling. So as I mentioned that बच्चे को word recognize करना नहीं आता है, इसमें decode नहीं कर सकता है वो कि उसने क्या read किया है, और वो spell out तो बिल्कुल ही नहीं कर सकता because उसने understand ही नहीं किया कि क्या मैंने read किया. Okay, so now I'll be talking about the symptoms of dyslexia. So the child will definitely have trouble making connection with letters, sound, spelling, and recognition of words. So when the child is already, experiencing dyslexia, जहाँ पे क्या होता है कि उसको read नहीं कर सकता है properly, तो read नहीं कर सकता, उसको समझ ही नहीं आ रहा है, reading उसको समझ नहीं आ रहा है, वो decode नहीं कर पा रहा है, letters को sound के साथ नहीं कनेक्ट कर पा रहा है, स्पेलिंग नहीं बोल पा रहा है, और रिकॉग्नाइज कर ही नहीं पा रहा है उस वर्ड को, वो ये डिफिकल्टी उसको आएगी बिकॉज ही हैज अ रीडिंग inadequacy. And the child will face a very hard time understanding what others are saying. And now that जब reading difficulty आ रही है, so it is difficult for the child to understand the other people as well at the same time, right? So उसको difficulty होगा to organize writing, also spoken language. सो रीडिंग स्किल्स अगर थोड़े से पुअर हैं, उसको राइटिंग का भी इशू रहेगा, उसको बोलने का भी इशू रहेगा, क्योंकि वो इन एजुकेसी उसकी राइटिंग और बोलने में भी रिफ्लेक्ट करेगी, राइट? सो इट इज कनेक्टेड. उसकी स्पीच में डिले होगा, उसको डिफिकल्टी होगी थॉट्स और फीलिंग्स में, राइट? बिकॉज जब बच्चे को कोई एक इनएडुकेसी है, सो एंड दैट इज समथिंग विच कैन नॉट बी just stay with the child. Of course that is going to come up in front of parents, teachers, और बहुत सारे ऐसे लोग होंगे जो उसको उस चीज की कमी को बार बार बोल के उसको ये realization करवाएंगे that you are poor in this thing or this is something you are struggling with. So बच्चे को जब ये बात पता चलती है तो वो अपने thoughts और feelings को express नहीं कर पाता है. And definitely this is the reason by which the children can go with all other emotional health concerns like anxiety, depression, even the self-esteem issues. Also such children will be facing difficulties in learning a new word. Vocabulary is going to be a very tough thing for them, right? Moving on to the another symptoms of dyslexia, which is trouble learning foreign languages. जब बच्चा को dyslexia है, reading का issue है, तो उसको foreign languages इतनी जल्दी समझ नहीं आएंगे, उसको songs, rhymes, उसमें भी बहुत issues लगेगा, slow rate of reading होगा, silently भी होगा, out loud भी होगा, ठीक है? एंड लॉन्गर रीडिंग टास्क होंगे उसके लिए, मतलब कि जो भी लॉन्गर टाइम where there is a longer reading things, so the child will easily give up on those things, right? Difficulty होता है उसको understand करने में, questions, following directions, और the बच्चे की जो spellings हैं वो definitely poor skills रहेंगे उसमें, और प्रॉब्लम्स रहती हैं नंबर्स को याद करना, जैसे कि टेलीफोन नंबर, एड्रेसेस, राइट? सो दिस इज व्हाट द चाइल्ड फील ट्रबल विद, and the trouble in telling left from right, which is again a issue for the child. Moving on to the next type here, this is apraxia of speech. When I'm talking of apraxia, which means difficulty to speak, right? So this is a speech related disorder, definitely speech and sound disorder भी कहा जाता है इसको, and verbal apraxia भी कहा जाता है. So it is completely related to speech, और इसमें क्या होता है कि when we talk about apraxia of speech, that affect basically the pathway of how a child is thinking, the brain is involved in it, and this has a connection with our mouth. Right now also when I'm speaking, so there is a certain thing which is in whatever is in my mind, which that signal is being connected with my mouth, and that is how I am speaking out to you, right? So अब जब अप्राक्सिया ऑफ स्पीच किसी को होगा तो ये कनेक्शन पुअर हो जाएगा, उसके माइंड में तो वो चीज है that what he or she has to speak, but the child or the individual will not be able to speak because this connection will be disconnected. Okay, so जो ब्रेन से मैसेज है वो नहीं मिल पाता है माउथ को करेक्टली. दैट इज हाउ दिस इज द थिंग दैट children or individual face. So I want to tell you that apraxia of speech has two types, two categories further. So one is childhood apraxia of speech and one is acquired. So when I'm talking about childhood, which means the child is having this from the childhood, right? This can be transferred through the genes, wherein there is a, you can say that that is a biological thing that is being happening to the child. And ये देखा गया है कि boys में ये ज़्यादा होता है comparatively to girls. And when I'm talking of acquired apraxia of speech is something that does happen later in the life. That could be the reason of maybe a traumatized experience, an accident, a stroke, a brain injury, or a brain tumor. So this is a later developed thing, and can be this is when I'm talking of acquired, this is basically happen later in the life due to all the incidences that I mentioned. So, okay, this is the difference, and these are the two types of apraxia of speech. Moving on to the symptoms, and when I have to tell you the symptom, so childhood, when the first I'm going to talk about the childhood apraxia of speech. So when we are taking up the wherein there is a biological transferring right genetic things are happening. So there is a delayed first word, so which is the first sign, only being able to produce a few words. बच्चा बहुत ही कम से वर्ड्स ही बोल पाता है, ठीक है, उसको जो साउंड्स हैं वो इकट्ठे उसको पुट टुगेदर नहीं कर सकता है. सेम वर्ड्स उसको डिफरेंट वेज में बोलने भी नहीं आते हैं. लेंथी पॉजेस लेता है फ्रॉम सेइंग वन वर्ड टू अनदर, और बहुत सारा स्ट्रेस उसको क्रिएट होता है टू स्पीक अ वर्ड, राइट. और ऑल्सो उसको बहुत ज़्यादा ट्रबल होता है विद लॉन्गर वर्ड्स विच आर वेरी लेंथी वर्ड्स, राइट. उसमें उसको डिफिकल्टी होती है, और उसको डिफिकल्टी होती है कुछ भी इमिटेट करना कि सेकंड पर्सन क्या बोल रहा है, ठीक है. And having to move the lips, jaw, tongue several times is a task. When I'm speaking, of course there's a lot of my bodily effort is there, especially of my mouth, right, and my brain. There is a connection. So there is a movement of my lips, there is a movement of my jaw, there is my tongue which is getting involved when I'm speaking. So ऐसे बच्चे जिनको चाइल्डहुड अप्राक्सिया ऑफ स्पीच होता है, तो उनको अपना फुल माउथ यूज करना डिफिकल्टी आती है. सो दिस इज अगेन अ सिम्टम. मूविंग ऑन टू द सिम्टम्स ऑफ acquired. Now the acquired is that has happened afterwards. It was not there in the childhood, but it has happened due to some accidental stage or brain tumor, some struggle or brain trauma, brain injury, anything. Fine. So this is also here. Also the symptoms are like the childhood apraxia of speech, but if I have to add on more things, a slower rate of speech जिसमें बच्चा धीरे धीरे बोलेगा, डिस्टॉर्शंस रहेंगे साउंड में, लॉन्ग पॉजेस लेगा कुछ भी बोलने में, और प्लेसिंग एन इक्वल अमाउंट ऑफ स्ट्रेस ऑन हर एक वर्ड में बोलने में उसको बहुत स्ट्रेस लगेगा, राइट. हैविंग टू मूव द लिप्स, जॉ, टंग, अगेन आई एम रिपीटिंग द सेम थिंग, उसको अपना माउथ फुली यूटिलाइज करने में एक ज़्यादा प्रेशर क्रिएट होता है, ठीक है. So these are the symptoms of apraxia of speech. Moving on to the another type of learning disorder, which is auditory processing disorder. So when you hear this word auditory, of course, it is a well-known, it's kind of a very great understanding you can get. Auditory means something to be listening or hearing. Something is wrong with listening or hearing. So जब हम ऑडिटरी प्रोसेसिंग डिसऑर्डर की बात करते हैं, वो एक ऐसा डिसऑर्डर है जो हियरिंग सिस्टम से इन्वॉल्व है. इसमें बच्चे को हियरिंग लॉस बिल्कुल नहीं, राइट. दिस इज समथिंग वेरी इंपॉर्टेंट यू हैव टू अंडरस्टैंड. बट देयर आर सर्टेन थिंग्स वेयर इन द चाइल्ड फील्स डिफिकल्टी विद हियरिंग the related task. सो जब भी सुनने की बात आती है उसमें उसका जो है करेक्शन ऑफ अंडरस्टैंडिंग व्हाट द अदर पर्सन इज सेइंग वो नहीं होता है. इसको हम सेंट्रल ऑडिटरी प्रोसेसिंग डिसऑर्डर भी कहते हैं. यहाँ पे पर्सन फेस करता है बहुत सारे प्रॉब्लम्स, क्योंकि अगर सुनाई क्लियरली नहीं देगा, रीडिंग में भी प्रॉब्लम होगी, कॉम्प्रीहेंशन में भी प्रॉब्लम होगी, और लैंग्वेज में तो 100% होगी, राइट. So talking about the symptoms of auditory processing disorder, these are significant difficulty बच्चे को आएगी किसमें, स्पीच में, especially जब एक background में noise होगा. Supposingly a child is trying saying something to you and there is a lot of noise behind, तो वहाँ पे बच्चे को और ज़्यादा difficulty होगी, क्योंकि उसको hearing there isn't hearing loss, but उसको hearing का problem आ रहा है because of the noise which the child or the individual is trying to hear out, वो mix up हो रही है background noise या background sound के साथ. So ये difficulty एक आती है, which is the first symptom. Second is difficulty following the multi-step directions, जो कि कोई आपको verbally बताने की कोशिश कर रहा है, तो the children will definitely face a lot of problem understanding that. So even if that is with the visual cues, but सुनाई देने में कुछ problem उसको लग रहा है, right? So easily distracted हो जाते हैं loud sound से ऐसे बच्चे, और difficulty होती है उनको long lectures सुनने में, difficulty होती है उनको remember करने में और effectively summarize करने में information को, जो कि उनको verbally guide की गई है. difficulty होती है उनको reading में, spellings में, writing में, when it is compared to other peer groups or other children of their age, right? So they also feel found themselves struggling, right? So उनको trouble होता है abstract thought ideas को सोचने में, उनकी जो उनको misunderstanding होती है jokes में, या humor उनकी life में थोड़ा difficult है, कि what the other person is saying, how they are laughing suddenly, what has changed, how come a person is telling a joke. These things are not normal for them because they have missed certain things. So maybe somebody has shared a joke, let's say, so there was a problem wherein they mismatched and maybe they haven't understood properly. So wherein everyone has finished laughing as well, they will be in a situation where they will feel a little disturbed, because if they have missed out something, they don't know if it was funny or not. So it becomes difficult for them to understand jokes, idioms, or figurative languages. And moving on to another type of learning disability or disorder, which is a visual processing disorder. Right now I was telling you about the auditory. So now when auditory is one of the things, the visual processing disorder is also there, that affects the learning, right? So that becomes difficult for the child to really participate well in their learning. So here the person definitely, or the individual definitely, faces difficulty interpreting the visual information. So when the child is experiencing visual processing disorder, they are likely to have the problems understanding what they are looking at. It is a problem related to vision. So here the vision they have may be 100% correct, but there is something which is not letting them to see the things properly. Let's say that there is a big physical object in front of them in the room, right? So they will be looking at that object instead of the entire room. Their vision would be more focused towards that object, which is quite a big in size, right? So this is something which actually makes the level of their visual processing inadequate. So they find problems with reading, with maths, with maps, with charts, symbols, and pictures. Also, I want to tell you that this visual processing disorder has 8 categories or 8 types in itself. I'm going to tell you one by one. Okay. Moving on to the first type of visual processing disorder. The first one is visual discrimination. Here what happens is there's a difference between letters and words the child will face. And second is visual figure ground discrimination issues. यहाँ पे क्या होता है कि word जो piece of paper में लिखा है, that if that piece of paper is colored, so वो बच्चे को interfere कर सकता है to see properly and to understand that what is being written here. Next is visual sequencing issues. So यहाँ पे बच्चा confused हो जाता है और mixed up कर देता है sequencing को. वो क्लियरली उस सीक्वेंस को ऑर्डरली अंडरस्टैंड नहीं कर सकता देख के भी, राइट, बिकॉज उसको इन एजुकेसी लग रही है यहाँ पे. I hope my audience is having a great time understanding about the learning disorder, because that has been really coming up, in this front line. There are a lot of cases that has been coming up. People are not getting why their children are behaving a certain way, what problems they are facing. So this could be a great guide and help to all of you. Please be attentive and listen to me and stay till the end. Moving on to another type of visual disorder, visual processing disorder, which is visual motor processing. So here motor की जब बात आती है, which means the child is having difficulty understanding the size, the shape of object that is in front of them. So basically they cannot relate कि वो जो size है और जो भी space है, distance है, वो object का कितना है. Is it a big object? Is it a small? जो कि उनको डिफिकल्टी इतना हो जाता है उसमें विजन का कि that they sometimes collide with the things, उनको इंजरीज भी आ जाती हैं because they can't understand nicely the distance between the two objects. So and they doesn't know what the huge size it is, so there is a problem that they do face, so that affects their learning for sure. And then another one is long or short term memory issues. So when I'm talking about memory issues, you understand the long term and the short term is there, and they find it very difficult to remember words and items. So you understand the short term memory, which is like quickly being recalled. Right now I will say that hi everyone. So if I'll ask you what I asked you, right, so it is that you can easily answer me that I said hi everyone. So when whatever I'm talking to you right now, if I'll ask you after a number of days, which is long term memory, which means now you have to process the information and let me know that what I was talking about. So this is a long term memory. Here यहाँ पे बच्चों को जब visual processing disorder की बात करते हैं हम, तो उनको डिफिकल्टी होती है वर्ड्स को रिमेम्बर करना, तो वो उसलिए उनका लॉन्ग टर्म शॉर्ट टर्म मेमोरी दोनों में ही इश्यूज रहते हैं. Moving on to the next type of visual processing disorder, another one is visual spatial issues. So any issue which is related with the space, with the distance, with the what is the area between the two objects, तो इसको हम कहते हैं कि visual spatial, right? So इसमें the child or the individual will face difficulty to judge the distance between the two objects. Give me a second. Okay, so moving on to the next type is visual closure issues. So now here the child faces, the problem when there is an interpretation of object in a room which are only partially inside. Supposingly, if a chair is blocking the full view of the cupboard, right, an individual may not realize that there is a cupboard behind, क्योंकि उस बच्चे को वो chair नजर आ रही है. So the first mainly focus is on the chair. So उसके पीछे का कबर्ड उसको नजर नहीं आ रहा. So उस basically उस chair के बाद there is a closure, there is no space. That is not the thing the child can easily process or understand. Fine. And the next one is letter and symbol reversal issues. ये एक major issue रहता है बहुत सारे बच्चों में, wherein there is a reversal thing that is in their mind. Supposingly, if I have given an example, कि यहाँ पे 6 लिखा है, right? 6 can be looked by that individual as B. So this is a reversal and issue that the children face, and that does interrupt their learning process. So I hope you're clear with all of these, the types which I mentioned about visual processing disorder. Now moving on to how will you get to know about the symptoms of visual processing disorder. So when I'm talking about the visual processing disorder symptoms, बच्चे को difficulty आएगा in writing. Frequently वो trip over करेगा, objects के साथ collide करेगा क्योंकि उसको vision में उन चीज़ों को देखने में problem आ रही है, तो most of the time वो hit कर जाते हैं किसी भी जगह में, right? So that is very dangerous for these kids. And they can't perceive the height, the depth of any object, and they can't even judge easily. So उनको trouble होता है sequence में, they may look at the sequence or like sequencing of words, numbers, everything is very difficult for them to recall. याद रखना उनके लिए is a difficult thing, and they're not being able to specify what kind of object they are looking for in the partial, only partially inside. तो ये भी एक difficulty है that they do face, and which is a symptom of visual processing disorder. So moving on to our last type, I hope that I was not too quick to cover up the whole things, but no worries. We have I'm going to discuss a case with you, and at the end I'll give you the intervention. So the last type is non-verbal, which is very clear. Anything that is related to the verbal cues, wherein there is a body, body language is involved, the facial expressions is involved, that is non-verbal learning disorder. So when we are talking about it here, the person basically face a challenge with specific group of skills. And what are those skills? Skills related to motor, visual, spatial and social skills. बच्चा जो है उसको बहुत ज़्यादा डिफिकल्टी होगा इन एनी सोशल इंटरेक्शन. वो बहुत ही हार्ड रहेगा उसका किसी के साथ भी सोशली इंटरेक्ट करना, बिकॉज उसको किसी के भी नॉन वर्बल क्यूज समझ नहीं आएंगे. वॉट एवर द पर्सन इज सेइंग उसका बॉडी लैंग्वेज नहीं समझ आ रहा है. सो दीज चिल्ड्रन फेस वेरी डिफिकल्टी व्हेन दे आर इन सोशल सेटअप. And the non-verbal learning disorder often have problems with coordination. Now when the child have this disorder, वो किसी के साथ easily coordinate भी नहीं कर पाएंगे, right? So I hope you have had the clarity of this. Moving on to the symptoms. So non-verbal learning disorder, इसके symptoms कैसे हमें पता चलेंगे? Fine motor skills में problem आएगी. कैसे वो मालूम होगा? जैसे कि holding of a pen would not be appropriate, right? जो उसके राइटिंग स्किल्स को इफेक्ट करेगा, उसकी कलरिंग को इफेक्ट करेगा. यूज ऑफ सीजर्स भी अच्छा नहीं होगा, बिकॉज व्हेन द ग्रिपिंग इज नॉट गुड फॉर होल्डिंग अप अ पेंसिल, सो सीजर होल्डिंग भी डिफिकल्टी को दे सकता है. कॉम्प्लेक्स मोटर स्किल्स होंगे, जैसे राइडिंग अ बाइसिकल, हिटिंग एंड कैचिंग अ बॉल will be a thing for them, right? Spatial disorientation, I told you that उनको space का understanding नहीं रहता, तो clumsiness रहती है. They keep on bumping into people, keep on bumping into the wall as well, right? So organization and planning में उनको difficulty आती है, problems होता है उनको कुछ भी prioritize करना, organize करना, complete करना task को, या मल्टीटास्किंग तो वो बिल्कुल ही नहीं कर सकते हैं. एंड विजुअल स्पेशियल जो मेमोरी है, विजुअल स्पेशियल मेमोरी जो है वो बहुत ही उनकी पुअर होती है. डिफिकल्टीज होते हैं उनको मेमोराइज करना, स्पेसेस को प्रोसेस करना, इंफॉर्मेशन. So with this, okay, we do have more symptoms. Okay, socio emotional skills, right? उनको ट्रबल होता है क्योंकि नॉन वर्बल क्यूज वो समझ नहीं सकते हैं, अंडरस्टैंड नहीं कर सकते, तो उनको हमेशा ट्रबल रहेगा टू अंडरस्टैंड द सोशल इंटरैक्शंस. ऑल्सो लोग जो बातें कर रहे हैं, दे कांट परसीव देयर सोशल क्यूज, दे कांट अंडरस्टैंड देम, देयर बॉडी लैंग्वेज, व्हाट दे आर टॉकिंग अबाउट. रीडिंग एटीट्यूड भी उनका नहीं पता चलेगा, फेशियल एक्सप्रेशंस नहीं समझ आएंगे, पॉस्चर नहीं उनको समझ आएगा, कैरेक्टर एंड टोन ऑफ वॉइस उनको अंडरस्टैंडेबल नहीं होती है, और जोक्स तो वो बिल्कुल अंडरस्टैंड नहीं कर सकते. रीडिंग द डायग्राम्स मैप इज अ टास्क फॉर देम. Putting puzzles together is a task for them. Mathematics is a big problem for them. Trouble solving math problems, क्योंकि उनको इस सब में पुअर है स्किल्स, क्योंकि वो समझ नहीं पाते हैं, तो मैथ्स में भी उनका प्रॉब्लम होता है. ज्योमेट्री समझना डिफिकल्ट लगता है, और हैंड राइटिंग इज अ बिग टास्क फॉर देम, इशू आता है उसमें. Okay. So with this note, I have finished with the types, and now you all are pretty aware about what is learning disorder. So if anyone of your loved one is experiencing anything of you, you can easily understand what the child is going through. Fine. So now I'll be discussing the case with you, that which is going to give you the more insight, that maybe probably a little bit of the idea that one second. That what the case I was handling and what the child was going through, this is something which will help you all also. When I share this, can be a great thing. So I was having these parents with me, and they just were in great stress, and they were depressed that what is happening with their child. The child's behavior was very abrupt, and the child was actually not cooperating with the parents, right? So I just got these parents through some reference, right? And they just came to me, and the mother was very emotional, saying that I don't know why my child behaves like this. She's 12 years of age, and she has no good tuning with us, neither with me, neither with the father, which is a great difficulty. And she's the only child, and she doesn't listen to us in any way. We are trying doing, and we have tried doing every possible thing to understand that what is going wrong with her. This was the high time. That is how we thought to just seek some help. She definitely is showing some emotional health concern which we can't understand, they mentioned. Also, when I interacted with the child, I later got to know that the child was also being beaten by the parents, right? And now coming to the point that what the child was experiencing, child has had multiple things going on. When I have to tell you the emotional health concern, definitely she had anxiety. She had the little bit of depressive symptoms, also the self-esteem issue. Why? Because the child was experiencing dysgraphia. So the child, basically, this, there was a disorder, learning disorder that she was experiencing. उसको राइटिंग में बिल्कुल भी मजा नहीं आता था, एंड शी यूज टू अवॉइड राइटिंग. एंड ऑफ कोर्स जब बच्चों को राइटिंग में कोई इंटरेस्ट नहीं आएगा, हाउ कैन दे रियली कवर अप देयर सिलेबस, हाउ कैन दे रियली कोप अप विद द daily pressure that is being built up on them to finish their work, finish their homeworks, finish their each task. There is a lot of things that on the daily basis. If we see schools curriculum, and there are a lot of things that wherein certain assessments are done, the homework is being given, the project work is being given, but everywhere the child is supposed to be writing. So उसको वो issue इतना ज़्यादा आ रहा था कि that was being creating a pressure in her, not only through the parent side, also from the school itself. The teacher was also trying, finding a solution for her, but she was not interested in that because she was inadequate in that. Nobody was understanding her, and when the pressure was created a lot in her, and that's when she developed emotional health concerns too. So now, why I shared this case, because sometimes it happens that not just being as parents, anyone, when you have your loved ones with you, when they are facing certain things, you need to maintain patience. That's what really inform the parents as well, that you should not panic about whatever is happening with you. If she is not understanding you from whatever time it is happening, with the right intervention, when I started with the intervention process, with the time, I understood that from the pandemic time this was been happening, that there were a lot of things that came up in front of mother. Before that, the mother was also working. She had no idea about what is going on. But मैं आपको एक सजेशन देना चाहती हूँ. एनी पॉइंट ऑफ टाइम व्हेन यू गेट टू नो अबाउट योर चाइल्ड कि कुछ भी इशू अगर आपका बच्चा फेस कर रहा है, और जब वो आपके सामने इशू आता है, the only point is you don't have to get panic. You need to give the support to the child. You need to become the support system for the child. Why? Because right now the child is already struggling. There is definitely something which is going wrong. The child has understood, because there were a lot of people around जिन्होंने उसको समझा दिया कि this is what's been wrong with you, or this is not right, or you're not doing your work, you're not doing that. So there's a pressure that is being built up already. So वो जो build up pressure है, वो उसका release नहीं हो पा रहा है. When parents are also really going to fight, or being very rude or strict to the child, of course what is going to happen is child will not be doing the very best he or she can. So right now here the best way is to give support to your child, and when you can't provide help, seek out for professional help. That's what is the right thing they did. And when they reached out to me, we started with the intervention plan. So now you must wanting to know that what is the intervention for such children, or if somebody is experiencing learning disorder. So I'm going to tell you again with the process. First I'm going to explain that how this is all being done. So the basic foundational approach is with the case intake. So case intake is done with the counseling sessions also. Why? Because there is a rapport building done, and here the client understands the therapist, and the therapist understands the client, and here the equation is being built. and that is how we can proceed further. And now during these counseling session and case intake, the therapist instantly get to know that what the trouble area is. So the assessment, psychological assessment is done, and after that, the psychological diagnosis is being made. So when the professional diagnosis is being made, so the intervention starts. So this is how the process works. So when somebody is being, diagnosed with learning disorder, so what exactly is the basic foundational approach I told you, and the intervention that starts with is definitely through counseling first. Secondly, the CBT is the great thing here, because here there is an inadequacy in certain skills in the child, which need to be fulfilled. There are a lot of ways through which we can fix this thing. So talking to the child, or starting with the CBT approach, which is cognitive behavioral therapy, is the best way out. Why? Because this here, what exactly happens is the behavioral changes are made to be built, the positive changes are being developed in the child. So inadequacy is being fulfilled with adding up something positive, so that the child develops the kind of strength back and develops attitude, positive attitude, towards whatever is being bothering and which skill is inadequate. So जब वो हो पाता है, that's when the child can actually start to understand. Also adding on DBT here, it is very much similar to CBT. In CBT, we do modify the behavior of the child, in wherein the negative things are converted into the positive. So it's kind of the behavioral changes. So when we talk about DBT here, this is more of a teaching sort of skills, wherein the individual is being taught the life skills that is being required for the child, or for any individual to be working upon any certain things that is being taught. In CBT, it's not taught. It's being the changes in the thought process is being built by talking to the person, making the person aware what's going wrong and what's not. Fine. And when I'm talking about a learning disorder, definitely there is an inadequacy in certain skills that need to be fulfilled through what? Through an individualized education program, which is very important. This is the main thing for when somebody is experiencing a learning disorder, inadequacy in certain skill. The child need a very individualized special plan, and a special education should be added on, so that the child can buck up with whatever is inadequate in the child. Also, the occupational therapy works wonderfully here, because there are certain skills which are inadequate that need to be developed in the child with a proper way and attention when is being given by the specialist. So of course that skill can be enhanced. So there isn't anything that cannot be, or this cannot be resolved. Of course there is a solution, because you need to go for a right approach. Okay. And moving on to next thing would be the academic support. What happens is that here, when we are talking about learning disorder, यहाँ पे प्रॉब्लम हमारे एजुकेशन सिस्टम में भी आ रही है कि समवेयर बच्चे को वो सपोर्ट नहीं मिल रहा. And supposingly there are more than 30-40 children in the classroom, so everyone may be understanding everything in a better way, but one of the child has this disorder. They can't really cope up with what teacher is saying or what is being happening in the class. वो उसको समझ नहीं पा रहे हैं. तो यहाँ पे एक स्पेशल एजुकेशन की जरूरत है, यहाँ पे एकेडमिक सपोर्ट की जरूरत है, जहाँ पे एक ऐसा एकेडमिक सिस्टम और सपोर्ट होना चाहिए जो उस बच्चे को भी एक स्पेशल ट्यूटर प्रोवाइड किया जाए, जिससे कि उस बच्चे के अंदर की कमी भी पूरी हो जा सके. And importantly, it's important when somebody is facing this disorder, there is a school-based program, which is the main thing that can help, or bring a great change in that child if somebody is suffering from this disorder. So इसमें क्या किया जाता है, एक इंटेंसिव प्लान बनाया जाता है, ऐसा टेक्निक्स यूज की जाती है कि 1-to-1 सेशंस होंगे विद दैट चाइल्ड, जिसको जिस भी स्किल की कमी है, लेट्स से रीडिंग और राइटिंग और मैथमेटिक्स, सो दैट इज बीइंग एनहांस्ड. ऑलराइट. एंड मटेरियल को इस तरह कट शॉर्ट करके स्मॉल बाइट्स में प्रेजेंट किया जाए बच्चे को, सो दैट द चाइल्ड कैन एक्चुअली हैव अ होल्ड ऑन इट. सो जब ऐसा हो सकेगा, सो चाइल्ड की अंडरस्टैंडिंग बढ़ेगी. और विजुअल एड्स प्रोवाइड किए जाए, मेमोरी एड्स प्रोवाइड किए जाए, मल्टी मॉडल होना चाहिए in teaching, which means that a universal model has to be there, apart from visual और auditory को ही सिर्फ focus करके नहीं, but universal model जो है वो ऐसा model होता है कि जिसमें कि every type of student can understand the things. It is fit for everyone. That has to be, you know, that has to be in a way wherein everyone can understand what is being taught. So universal होना चाहिए कि अगर ऑडिटरी वाला बच्चा है तो विजुअल, उसको ऑडिटरी मॉडल भी उसमें हो कि वो उसकी लिसनिंग स्किल से, विजुअल स्किल से वो पढ़ सके, अच्छे से समझ सके. अगर जिसका विजुअल का प्रॉब्लम है तो वो ऑडिटरी से कोप अप कर सके. तो देयर शुड बी अ मल्टी सोर्स, सो दैट कि अगर एक तरह से कमी है तो वो दूसरी तरह से पूरी हो जाए, राइट. एंड बच्चे, ऐसे बच्चों को बहुत ही मोटिवेशन चाहिए, गोल चाहिए. देयर हैज टू हैव अ स्पिरिट इन द चाइल्ड, एंड द चाइल्ड नीड्स टू बी motivated not only by the parents from the family, but also from the community, also from the school where they are going, right. So the school has a great role in it to modify, to shape the children. So of course I will say that this is what required for the proper intervention of the child. And not just this, when any child is struggling from the disorder, which is learning disorder, so definitely as I told you कि वो disorder सिर्फ उनके ही समझ तक नहीं रहता है. There are a lot of people who are just creating a chaos into their life, maybe telling, forcing them to do this, to do that, and maybe again and again repetitively that is being heard from their parents, their siblings, maybe from their outside community, maybe the school, right. The teacher must be saying it again and again. So that creates a pressure, and that actually develops or give them a lot of emotional health concerns too. Initially also I mentioned that these children are tend to develop depression, anxiety, stress, definitely, and self esteem issues are seen a lot in these children, because उनको जब वो अपनी inadequacy समझ आती है, so that's when they start to feel really bad, that they think that they are not really capable of doing all this, and maybe they are not good enough in this skill. So उससे क्या होता है कि उनको low self esteem develop हो जाती है. That becomes an emotional health concern जो उनको problem करने लगता है. So of course there's a lot of therapies for that also. Psychotherapy, EFT works wonderfully when children are being taken to a therapist. Right there are a lot of therapies that are being going, in which EFT plays a huge role, because here there are a lot of things that is being stick inside the mind of the child. Why? Because the child constantly keep thinking about what कि मैं इस चीज में I think I'm not good enough in this. So which becomes their limiting belief. We need to cut down that thing. So we need to work on it. And when given a EFT therapy, which is emotional freedom technique, we modify the child's behavior. This is what is being done with this child as well. That is how the child is showing great results, working very well, and the writing is improved. Even the reading has been improved in the child. So it's not that the end of the story here. There's a lot of things that the family system can provide to the child. Family has to become the support. The school has to give some motivation, some kind of a support system, and individualized plan. Programs should be created. Special education should be created for these children, so that they can get a safe study environment, and they should not be missing anything. And with this, I hope you all have a great understanding about what is learning disorder. On the screen, I'm leaving on with my details of my official profiles, which is of Good Mental Health Profile, starting with the website, which is www.goodmentalhealth.in. And if somebody would like to reach out to me through my email, which is info@goodmentalhealth.in, and I am available in LinkedIn, Facebook, Instagram, Twitter, and I have a channel in YouTube with the name Good Mental Health by psychologist Anuradha. Also, I'm running a podcast station that also is with Good Mental Health podcast series by psychologist Anuradha. So these are my details. I hope you had a great time listening to me, and there isn't any, if anyone has certain questions, they can ask me, and you can even reach out to me through all my platforms which I have mentioned. So, with this beautiful note, I hope you all have had a great time listening, understanding the in depth of what is a learning disorder. You can definitely help out to your loved ones, your children, and you can support them, give them a big support, give them encouragement, a motivation towards, fulfilling their, fulfilling their inadequacy. So you have to become the great strength for your child, none other than you, who can provide the best help. Because parents are not only just the parents, they can become the friends and the great support, to the child, also the strength of the child. So, with this beautiful note, I would like to take your leave. Hope you had a great time. Happy listening and on Disorder Dialogue series by Good Mental Health, which was DD6 on learning disorder. So I would like to take your leave saying goodbye until we meet next time. Very soon we are going to meet with the next disorder, which is going to be DD7. And I will share the name very soon on my social media platforms. You can stay connected with me through my all social media platforms. And when you will watch out to this video, definitely try connecting with me through all the social media platforms where you are available. So I hope you had a happy time listening. So till we meet the next time, have blissful days. Thanks for listening.